Well, Ontario is setting new records for the number of positive COVID-19 cases almost daily. But for weeks, the numbers in this region have stayed low. However, that is all changing now. From Saturday through yesterday, the health unit reported 15 positive tests. As of today, there are now over 20 active COVID-19 cases in the Thunder Bay area. Dr. Janet DeMille is the Medical Officer of Health for the Thunder Bay District Health Unit, and she joins us this morning to discuss the implications of these numbers. Dr. DeMille, good morning.
Good morning.
So over 20 active cases, a very significant jump for our area. What is the message that you want people to take from those numbers?
Yeah. So first of all, thank you very much for the opportunity of me being able to speak today. I recognize how our numbers seem quite disconcerting and how it changed very quickly. And certainly what we see across the country and across the province, it's uncomfortable to see this also happening here. I think, though, I really want to tell people it's important not just to look at the number, but really the story behind the number and what is actually happening. And I feel, as we've navigated this, and we're still very actively involved, very actively following up. And we did very intense follow-up, even on the cases from last Thursday and Friday on this. What we see in our numbers is that COVID-19 spreads in households. So sometimes when an individual has COVID-19, they could spread it to their people living with them. And what we're seeing and what we identified on Saturday and have been managing is that we have a living a supported living place where individuals reside, and they are now having an outbreak of COVID-19 in that particular facility. People live there, and the same way COVID spreads among people in the household, it has spread in this particular facility. So that is actually what's primarily driving our numbers up. This is something that we very comprehensively follow up on every case of COVID-19. We ask them a lot of questions. We follow up about where they were, and we always make sure that they're isolating, and so that they're not spreading it to any others. We also identify everybody who's a high-risk contact, anybody who might have been exposed who could be incubating the virus, even if they don't yet have symptoms. They certainly could be incubating, and we assist people in isolating and being supported in that isolation, so they're not posing a greater risk to the public. And on Saturday, we identified this high-risk exposure in this particular place where people live, and we suspected it could be an outbreak, even though we didn't have confirmed cases. And what you see happening over the last couple of days is we've been following up on that particular situation and starting to detect the other cases that were actually there. But it is important to realize that the individuals have been isolating, and the cases that we're now finding are individuals who have been and they're not posing any ongoing risk. So that's and so more broadly in terms of what's happening in the community, one of the things we have had 23 cases in the last week, and only one of them do we not know where the person acquired the virus. For everybody else, we know exactly where they got the virus from and from whom they got it from. And that is a really important indicator, because it really shows that we know where the spread is happening and we're containing it. When we start to see more people where we don't know that they got the virus, that's an indication of broader community spread. There's other things I think that we can be, feel somewhat reassured by. There was nobody in hospital with COVID-19. Other indicators, like when you look at what's called the percent positivity of the tests, we're still fairly low. That means that there's a lot of people being tested who are negative, which is actually helpful in monitoring what's happening in the community.
Well, if I could just ask you about testing, because the health unit has also issued advisories about several locations located to cases. So should people who were there during the specified times get tested?
No. Well, actually, so what we've advised is that people who were there should monitor themselves for symptoms and then get tested if they have symptoms. So these were all low-risk exposures, just based on our investigation and understanding of what individuals were doing there and the types of interactions they may have had with others. We would deem these low-risk exposures. So we're just advising people who were in any of those locations, if they get symptoms, to go home and isolate and arrange for testing. And certainly if people have questions, about what to do or how to do that, they can go to our website or they can give us a call.
Well, there were a number of locations as well. So I believe it was the super thrift stores. There was at a certain time at the complex. There was a church. So what should people take from the fact that so many locations have been mentioned?
Well, it means that what we're doing is we're following up with individuals who had COVID-19, and we've had a number of them right over the last week. That's 23. We follow up with all of them. We find out what they were doing when they were infectious, and people are infectious 2 days before they get symptoms. So we follow up even on that period. What were you doing? What kind of interactions that you have with others? And then if we deem that the public may have been exposed to the virus, we would announce that through our social media and put it out publicly.
If we could take a wider view now, we're seeing those numbers go up in other places as well. We've seen Manitoba go back into a lockdown. How close do you think we could be to going back into some sort of lockdown here?
So, the reality is this is a pandemic, and things can change very quickly, and we need to be able to respond to things when it changes. However, I think we should take comfort that over the first wave of the pandemic, throughout the summer, and even the beginning of the fall, where we saw rising cases in other areas, and we weren't particularly impacted here, whatever it is about our area, our region, there seems to be just a lot of protective factors here, and that it could include our remoteness and a sort of relative isolation from these other areas. But things could happen very quickly, and we need to be mindful of that, and restrictions will be imposed as needed as we go through that if we start to see a substantial increase in cases, especially ones that are indicative of community spread.
Well, Dr. Teresa Tam has recommended that people reduce our social contacts by a quarter. What does that actually look like in someone's life? Can you paint a picture for me?
So everybody needs to look at the interactions that they have with other people, and recognizing that every single interaction has the risk of spreading the virus, and that they need to take all protective measures to reduce that virus spreading. And even if any one of us had COVID, we could spread it to others. And so that includes the 2-meter distance. It includes the masking. It includes hand washing. It also means, stay home if you have any symptoms, because that could be COVID. It may be unlikely, but it could be. But if you're home, you're not going to spread it to other people. So, and it's also about the number of interactions we have. So if you live at home and you have a family, if you go to work and you're interacting with your worker, with others at work, if you're going to watch your child play hockey practice and you're hanging out with other parents, we have a lot of interactions with other people, and we may need to, as much as possible, not only maintain all those measures in each and every one of those interactions, but even reduce overall the number of interactions that we have. So consider doing things electronically. Don't gather together with other people. Do it electronically. This is the time to really think about doing that. We would encourage employers to support their workers in working from home so that there's less people in the workplace, or have altered shifts so that there's less people in the workplace at any given time. All of those measures help us collectively reduce the number of interactions we have that could be either we could be exposing ourselves to COVID or passing COVID that we may have onto others.
And finally, I want to ask about the high-dose flu vaccine, because I understand there was a limited supply and that in other health units they've run through their supply. What is the situation here?
Yeah. So unfortunately, the flu supply issues have been significant and unexpected. And my understanding is that the high-dose flu, which is targeted for individuals over the age of 65 primarily, is really not available anymore. There's minimal availability. With respect to the rest of the vaccines, we're even having challenges. We, as a health unit, we provide to our healthcare partners, including primary care, who are key partners in this, and we are not receiving the supply we were expecting, and that's in all of the other different types of flu vaccines, for individuals under 65 and such. So it's definitely a challenge. We do expect to get some in, weekly, but really not enough to meet the current demand. I do know that our pharmacy partners, though, they may have a little bit more predictable supply. So certainly, if people, it's still encouraging people to get the flu vaccine. Call your healthcare provider, seek out a neighboring pharmacy, and if you have children under 5 who can't be immunized at a pharmacy, call us.
Dr. DeMille, I really appreciate your time this morning. Thank you.
Thank you very much.
Dr. Janet DeMille is the Medical Officer of Health for the Thunder Bay District.